Welcome back to Decode Healthcare with Harshal for part 54 of our 100-part ICD-10 CM Guidelines series. I am absolutely pumped to step into Chapter 15 today, Pregnancy, Childbirth, and the Puerperium. In today's explainer, our mission is fiercely focused on mastering Sections I, C15, A, B, and N of the CMS official guidelines. We are going to decode trimester calculations, get right into the weeds of gestational age Z3A stacking, and nail down the mandatory Z17 outcome of delivery rules. If you want to master medical coding and avoid some really critical audit traps, you are in the exact right place.
Here is a quick look at our agenda for today. We're covering the Golden O-Code rule, trimester calculation laws, gestational age stacking codes, the mandatory outcome of delivery, and finally, the newborn audit trap.
All right, let's jump right into Section 1, the Golden O-Code rule, and why Chapter 15 takes priority. So, I want you to think about this scenario for a second. What happens when a pregnant patient comes in with an acute condition? Let's say hypertension or maybe a really severe respiratory infection. If that condition complicates her pregnancy, is aggravated by it, or is the main reason she's seeking obstetric care, which code actually wins out as the primary diagnosis? While the CMS official guidelines give us the absolute rule of law here, they state that Chapter 15 codes have sequencing priority over codes from other chapters. Essentially, O codes always take precedence. You do not code the standard body system condition first. Instead, the obstetrics code comes first, acting like a giant umbrella to tell the payer that this condition is fundamentally affecting or being affected by the pregnancy. Now, the only exception to this golden rule is if the pregnancy is purely incidental. Unless the provider explicitly writes down that the pregnancy has absolutely zero bearing on the condition being treated, you've got to sequence that O code first. If and only if the doctor explicitly documents it is not a factor, then you can assign Z33.1 for an incidental pregnant state as a secondary code. But if you don't see that specific documentation, the O code rules them all.
Moving on to Section 2, Trimester Calculation Laws, Getting the Timing Right.
You absolutely have to memorize these week and day boundaries because that final character of your O code hinges entirely on this math, which is based on the patient's last menstrual period. The first trimester is strictly less than 14 weeks and 0 days. The second trimester spans from exactly 14 weeks and 0 days to less than 28 weeks and 0 days. And the third trimester kicks in at exactly 28 weeks and 0 days, going all the way until delivery.
Now, things get a bit tricky for inpatient stays that cross trimesters. Say a patient is admitted for a complication in her second trimester, but she actually stays in the hospital and doesn't deliver until her third trimester. What do? Well, the CMS rule is incredibly specific here. You must assign the code based on the trimester when the complication developed. That means you code the trimester upon admission, never, ever the discharge trimester.
All right, let's tackle Section 3, Gestational Age Stacking Codes, specifically Category Z3A.
Unpacking Category Z3A is absolutely vital. This category specifies the exact completed weeks of gestation, and it's a mandatory secondary code on all maternal obstetrician records. If you miss a Z3A code on an obstetrician claim, you are looking at immediate clearinghouse edits and claim rejections. Why? Because payers and CMS need this code to pinpoint the exact clinical severity and timeline of that pregnancy.
Think of this like a mandatory pair of puzzle pieces clicking into place on a claim form. Your primary O code drops into slot number 1, and immediately following that, your Z3A weeks of gestation code snaps right into slot number 2. It's an obstetric mandatory pair. You almost never have an O code without a Z3A code backing it up on a maternal record.
But here is the catch, and you really need to remember this. CMS strictly defines this by completed full weeks. So if your patient is at 39 weeks and 6 days, she has not reached 40 weeks yet. You cannot round up in medical coding. If the documentation says 39 weeks and 6 days, the completed weeks are exactly 39, meaning your code is Z3A.39. Fierce accuracy to the text is what separates average coders from expert auditors.
That brings us to Section 4, Mandatory Outcome of Delivery, Category Z37.
Category Z37 is your mandatory outcome of delivery code, and it is required on the mother's record whenever a delivery happens. This code tells the story of the outcome, whether it was a single live birth, like Z37.0, or twins, both live-born, like Z37.2. A couple of massive tips here. It is always a secondary code, and you only use it on the exact admission where the delivery actually occurred. Do not carry this over to subsequent postpartum office visits. Finally, let's look at Section 5, the newborn audit traps, and maternal versus newborn claims. You really need to recognize the stark contrast between a mother's claim and a baby's claim. The Z37 outcome code belongs entirely on the maternal claim. If you even attempt to put a Z37 outcome code or literally any Chapter 15 O code on the baby's chart, it is going to be instantly denied. For the baby's claim, you have to use category Z38, the live-born infant code. The CMS guidelines are fiercely strict about this separation. As this rule states, Chapter 15 codes are to be used only on the maternal record, never on the record of the newborn. Keeping O codes in maternal outcomes completely off the infant's medical record is just the absolute bedrock of obstetric compliance.
So before you submit your next delivery claim, you've got to pause and ask yourself the ultimate compliance question. Am I coding for the mother or am I coding for the baby? Mixing those up could literally cost your practice everything. Thank you so much for joining this explainer. Make sure you hit that subscribe button, drop a like, and share this with your fellow coders. Join us next time for part 55, where we're going to conquer ectopic pregnancies and complication stacking. Keep decoding, and I'll see you then.